أهلا بيكم. Today we're going to uh, start concluding actually the upper respiratory tract, the upper airway by studying the nose. So let's start. Um, the nasal cavities are elongated cavities on each side of the nasal septum. They are narrow above and wider below. They have a wide base. They open anteriorly through the so-called nares and posteriorly through the choana. Of course, the nares anteriorly opens to the outer air and posterior choana open to the nasopharynx. We studied that in the nasopharynx. They are bigger posteriorly than anteriorly and separated from each other by the nasal septum and from the oral cavity by the hard palate. Okay, that's as simple as it gets to describe the nasal cavity. Now, when you dissect the nose, you will be able to identify three main regions. Anterior region called the vestibule of the nose. This is the vestibule of the nose. It's shown here, by the way. The left side is being cut and the right side from the inside is showing. As you can see, it's lined by skin, hairy skin. This is called the vestibule of the nose. A bigger, much bigger part, which is the respiratory part, the respiratory region. It's the largest part, and it's lined by the respiratory epithelium. We know this is the pseudostratified columnar ciliated epithelium with goblet cells to secrete mucus, and a narrow olfactory part at the top, at the apex. It occupies the roof of the nose, actually, where you will find the olfactory receptors for the cell that contains the cell bodies of the olfactory nerve. The cell bodies of the olfactory nerve give rise to see these filaments called the olfactory filaments that penetrate the part of the ethmoid bone called the cribriform plate of the ethmoid bone and gathers in a neural mass at the inside in the anterior cranial fossa called the olfactory bulb that gives rise to the olfactory tract and back to the destination and the central nervous system. So we have three regions. The olfactory part, superior part, remember this, it occupies the roof. Vestibule, anterior part that's lined by skin, and the rest and the largest part is the respiratory part or respiratory region that is lined by pseudostratified columnar ciliated epithelium with goblet cells. Of course, the function of the nose, breathing, but also remember the mucosa of the nose is richly supplied with blood, extensive blood supply, and extensive anastomosis between the supplying vessels. This means that the nose is liable for hemorrhages called epistaxis, and all of us, I think, got an episode of epistaxis. That's why this rich blood supply carries the temperature of the blood with it. Okay, this means that the air entering the body will be adjusted, the temperature will be adjusted to the temperature of the body, as well as the humidity. It humidifies and adjusts the temperature of the inhaled air to the body, to the lungs. What else? Well, I told you that the biggest part is the respiratory region that's lined by pseudostratified columnar with goblet cells means it secretes mucus. This mucus traps the particles and foreign bodies in the air, and this will be eventually swollen through the mucus. So this is the function of the mucus, to humidify the air and as well as trap the particles in the air to prevent it from going to the lungs. If you want to classify the nose, or divide the nose actually, we have an external nose made of cartilage and an internal nose made of bone. So we have external cartilaginous nose and internal bony nose. Okay. The external nose, it's like I said, it's made of cartilages. It's not one piece of cartilage. No, it's multiple cartilages. Two major septal cartilages at the top. You can see them here and here and here. The septal cartilages and a bunch of alar cartilages. You have two major ones, like this one, for example. This is a major alar cartilage, and 3 to 4 minor cartilages for the rest of the external nose. Okay, so we have in the external nose, you should know that it's made entirely of cartilage, and actually it includes the vestibule of the nose. And the cartilages, you don't have to study them individually, of course, but just know that there are septal cartilages near, septal means near the septum, and alar cartilages in the ala of the nose. In the ala of the nose. The ala that guards the nares, of course. The internal or bony nose. The medial wall of the internal nose is the nasal septum. By the way, it doesn't mean that only the bony nose has a septum. No, the septum extends into the external nose, but it's made out of cartilage. Okay, so we have a medial wall, which is the nasal septum. This is, of course, the nasal septum. It's formed mainly by the vomer, big part, and ethmoid bone. The vomer is at the base of, and it's narrow anterior and wide as it goes posteriorly, and a perpendicular plate of the ethmoid that completes the nasal septum. That's why you don't see the vomer actually from in front. You can see it from the back. It's a big bone, but it's triangular in shape, and the posterior part is bigger, much bigger than the anterior part. See that? This is the vomer. It's an individual bone, by the way. There's a problem, actually, common problem that occurs in the nasal septum. It's called deviated nasal septum. Some people, when they get this, it's like an anomaly, and it varies. Some can tolerate a slightly deviated nose, which nasal septum that gives symptoms only, for example, in seasons, like an allergy or something. But the deviated nasal septum, the deviation degree of deviation may be severe, that it may occlude one of the nasal cavities, and this is a big problem. It needs surgical correction, of course. So don't forget the deviated nasal septum. This is the medial wall. The floor, from the inside, it's smooth. In the nose, I mean, it's smooth. It's made by the maxillary bones and the palatine bones, means that it's the hard palate. So the hard palate is the floor of the nose. What will you expect to find in the floor of the nose? You will find the openings, the incisive canals that lead to the incisive incisive foramen at the front of the hard palate. Okay, so remember this. The floor of the nose is the roof of the oral cavity. There are common walls in the face, like for example, the medial wall of orbit is the lateral wall of nose. The nose, don't forget this, the nose lies between the orbits, not beneath the orbits. It's between the orbits. Okay? So this is a good area for questions, by the way, for the floor of the nose. What is it made of? Remember, it's shared by the maxillary plates and the palatine plates, which is actually the hard palate. Okay, the roof. The roof of nose, as you can see, this is the roof of nose. It's big. Okay, but cavity-wise, it's narrow, but this is the roof. It slopes inferiorly at front and at the back. See? At the back and front, it slopes inferiorly. And in the middle, we have the cribriform plate of the ethmoid. The roof continues, of course, into the external nose and formed by cartilage, and posterior by the cribriform plate and the sphenoid bone. Okay? Now, anterior to the cribriform plate, plus the fenestrations in the plate, you will find special foramen for the anterior ethmoidal nerve and vessels. This is different than the foramen cecum we're going to talk about later. The sphenoidal sinus opens into this recess, which is called the sphenoethmoidal recess. So when we talk about the paranasal air sinuses, remember that all the paranasal air sinuses except the sphenoid open in the lateral wall of the nose. But the sphenoid sinus, this is the sphenoid sinus, the cavity inside the body of the sphenoid on each side, opens in the roof of the nose. This makes a difference in multiple choice questions. See, this is here a picture of the dissection actually of the cribriform plate of the ethmoid, illuminated to make it apparent. And this is called the crista galli. It's like a ship sail in the anterior cranial fossa, and anterior to it you will find the foramen cecum, the one we're going to talk about later. And anterior to these foramina here, you will find the special foramen for the anterior ethmoidal nerve and vessels. This is a picture of the anterior cranial fossa, where in the middle where the crista galli is, and the cribriform plate on each side. This is actually the ethmoid bone. Okay, remember the information about the sphenoid air sinus, that it opens in the roof of the nose, not the lateral wall. The lateral wall, this is full of openings and structures. Now, the lateral wall, it has three projections. First of all, it's made mainly by ethmoid and the inferior concha. Now, let's stop here. Ethmoid and inferior concha, or inferior turbinate bone. This means that the inferior turbinate bone is an individual bone, and this is a question I got in the USMLE. The inferior concha is an individual bone. It does not belong to the ethmoid. It grows by itself as individual bone. This is very important. So it's made up by the ethmoid mainly and the inferior concha. Now, what about the conchae? Concha, or conchae, plural, or turbinate bones, they are projections from the lateral wall, shelf-like projections that divide the nasal cavity. They are three in number. They are superior concha, middle concha, cut here, and inferior concha, cut here. This is the inferior one, this is the middle, this is the superior. Note that the middle and superior concha unite in front. See that? While the inferior concha goes separately alone. The middle and superior unite anteriorly. This is another question. Unite anteriorly, but the inferior concha, no, does not unite with the middle, for example. The three concha, three elevations, divide the cavity into 4 air channels. The inferior meatus below the inferior concha, the middle meatus below the middle concha, superior meatus, this thin meatus here, below the superior concha, and the sphenoethmoidal recess, which receives the opening of the sphenoid air sinus. Again, inferior meatus, middle meatus, superior meatus, and the sphenoethmoidal recess. Now, what's the purpose of these shelf-like projections? First of all, it guards the openings of the paranasal air sinuses, because the paranasal air sinuses, they are lined by respiratory epithelium, so there is mucus secreted inside them, so it must be drained or it will precipitate for infection. And this is actually what happens in sinusitis. الناس اللي عندهم جيوب أنفية. This is what happens in sinusitis, that the mucus is not drained well and maybe clogged or something, and the mucus inside gets infected, bacterial infection. So the purpose of these concha is to guard, to protect, to cover the openings of the paranasal air sinuses, and it increases the tremendous increase in the surface area of the mucosa of the nose. Increase in the surface area means increase in the blood, means better control of the temperature of air and humidity of air entering the body. Okay? So it has purposes. It covers and protects the openings and increases the surface area of the mucosal lining. Notice that there are no conchae in the vestibule of the mouth. Means no conchae in the cartilaginous part. It's only in the bony part, and it's easy to remember this because you know now that the concha, the middle and superior, belong to the ethmoid bone, and the inferior concha is an individual bone. Okay, now we will not mention the sphenoethmoidal. We will not mention the opening of the sphenoid because we said that it does not belong to the lateral wall. It belongs to the roof. Now, in the superior meatus opens the posterior ethmoidal air cells. We will talk about this in details with the paranasal air sinuses. In the middle meatus, most of the rest of the paranasal air sinuses open. See? You will notice in the middle there's an elevation. It's a balloon-like elevation called the bulla ethmoidalis. Bulla ethmoidalis. Now, on the top of this bulla, you will find an opening, or right superior to it, that belongs to the middle ethmoidal air cells. Actually, what formed the bulla is the middle ethmoidal air cell or air bubble. This is the medial wall of the middle ethmoidal air cells. Now, because you have a projection, so it's logic to have a depression that surrounds it, a gutter-like depression. This depression is called the hiatus semilunaris, the semilunar hiatus, hiatus semilunaris. In this hiatus opens several paranasal air sinuses. For example, at the front opens what's so-called the ethmoidal infundibulum. Infundibulum is funnel-shaped that receives the canal that extends from the frontal paranasal air sinus to the nose. It receives the opening of the frontal paranasal air sinus. It's called the frontonasal duct. Frontonasal duct opens in the infundibulum at the anterior part of the hiatus semilunaris. All these informations are good topic for multiple choice questions. Frontonasal duct opens through the infundibulum and frontonasal duct, frontal paranasal air sinus opens through the frontonasal duct into the infundibulum, which lies at the anterior part of the semilunar hiatus or hiatus semilunaris. Now, the anterior ethmoidal air cells either open separately in the hiatus semilunaris at the anterior part or join the infundibulum and the frontonasal duct to open in one opening. It doesn't matter as long as that it does open in the wall. It must be drained. So we mentioned the frontal air sinus, we mentioned the anterior ethmoidal air sinus, we mentioned the middle and posterior ethmoidal air sinuses. Now what's left is the maxillary air sinus. Maxillary air sinus is it's called maxillary because it's formed in the maxilla at the sides of the nose, and it's a big air sinus. We will study it, and opens in the hiatus semilunaris in the middle, either by one opening or multiple openings as shown here. But you should know that the major opening, of course, is in the middle of the hiatus semilunaris, not posterior, not anterior, and it's right beneath the bulla ethmoidalis. So the opening of the maxillary air sinus below the bulla ethmoidalis in the middle of the hiatus semilunaris. Okay? What else? In the inferior meatus, there is an opening at the front. It's called the nasolacrimal duct opening. Nasolacrimal duct, from its name, it comes from the lacrimal sac in the eye through a duct in the lateral wall of the nose that opens in the inferior meatus. Why? It drains the tears, excess tears, to the nasal cavity. Of course, you cannot find this high up because the tears will drop inside the nose, and this is not acceptable. So it will be like raining inside the nose. No, it's in the inferior meatus, at the anterior end of the inferior meatus receives the opening of the nasolacrimal duct. And please do not confuse this with the frontonasal duct. The nasolacrimal duct differs than the frontonasal duct. Okay? Frontonasal is for the paranasal air sinus. The nasolacrimal duct is for tears and comes from the lacrimal apparatus. We will study this in the eye. This is a real specimen here showing the lateral wall of the nose. Of course, this is the inferior concha. This is the inferior meatus. This is the middle meatus with the bulla ethmoidalis and the opening on top of it. And this is the hiatus semilunaris with the anterior opening, as you can see here. This is the superior concha, and this is the superior meatus that receives the opening of the posterior ethmoidal air cells. And of course, the sphenoethmoidal recess, which does not belong to the lateral, again, I'm stressing on that, does not belong to the lateral wall. It belongs to the roof of the nose and receives the opening of the sphenoid air sinus. Okay? Now, the openings, we talked about the openings again. The sphenoid sinus in the roof. This is about the whole nose. Now, it's not only the lateral wall. The sphenoid, the maxillary, the ethmoidal infundibulum for the frontal and the anterior ethmoidal air cells, the middle ethmoidal air cells and the bulla ethmoidalis again, and the and the maxillary sinus, in the hiatus, in the middle of the hiatus semilunaris, and the nasolacrimal duct in the inferior meatus. Okay? Okay. Now, the Regarding the anterior and posterior openings, imagine you can get questions about these. First of all, the posterior opening of the nasal cavity is called the choana. The choanae, the two choana, are made of, completely surrounded by bone. They are hard openings. There's no cartilaginous element here at all. And second thing, it opens into, yes, the nasopharynx. Okay, so the choanae open into the nasopharynx. Okay, it's made by the nearby bones, as you can see here, and divided, of course, divided by the septum. This is, by the way, the posterior end of the vomer. See, it's big. On the contrary, on the anterior side, yeah, it tapers anteriorly as a triangle. The anterior openings are called the nares. Nares are the openings in the cartilaginous nose or the external nose. Now, the big difference here, note that the posterior openings open horizontally into the nasopharynx, while the anterior openings or the nares open inferiorly, not horizontally, inferiorly. So this is a major difference. The anterior nares opens inferiorly, while the choanae, the posterior openings, open horizontally. So learn the difference between the two openings, please. First, that the posterior are completely surrounded by bones, the anterior are cartilaginous, and that the posterior opens horizontally and anterior opens inferiorly. Do not forget this. Now, gateways. How can I gain access to the nasal cavity? Different ways, actually. Of course, we will not talk about the openings again of the paranasal air sinuses. Yes, it's an access to the nasal cavity, but we are talking about other openings that lead to the nasal cavity. For example, the cribriform plate of the ethmoid. It's fenestrated to allow for the passage of the olfactory filaments that will form the olfactory bulb in the anterior cranial fossa. These are openings, and with the foramen cecum, of course. What else? See that? This is the middle concha. Right at the top or superior to the posterior end to the middle concha. Remember, superior to posterior end of middle concha means that it's in the posterolateral wall of the superior meatus, right? This is the sphenopalatine foramen. This is a very important foramen, the sphenopalatine foramen. It's the communication between the nasal cavity and the pterygopalatine fossa or the sphenopalatine fossa. We will study the sphenopalatine fossa when we study the infratemporal fossa. The sphenopalatine foramen. Now, the sphenopalatine foramen allows for the nasopalatine nerve, a branch of maxillary, for the sphenopalatine branch of maxillary artery as well, and nasal branches of the maxillary nerve pass through the sphenopalatine foramen. It's a very important foramen. Don't neglect that. Okay, what else? We have the incisive canal. See? Now you see it as single opening in the hard palate when you look from the inferior side. But actually it's a single opening, yes, but it receives two canals, one on each side of the nasal septum. The incisive opening receives the incisive canals, plural, two canals and one opening. The two canals, one at each side of the nasal septum at the front, right behind, see the incisor teeth, right behind the incisor teeth. What else? There are lots of small foramina in the lateral wall that allows for passage of branches, like example, branches from the greater palatine artery vessels. When it descending into the palatine canal, when it descends, it gives branches that penetrate the lateral wall to supply the nose. And what else? Well, you can loop around the edge of the nares. I mean, there are branches from outside that loops around the edge of the nares, anterior nares, of course, branches from the facial, branches from infraorbital, that gain access to the nasal cavity to supply the walls of the nose. And we have the famous foramen cecum. Foramen cecum is front of the crista galli, and between it and the frontal bone, the foramen cecum. The foramen cecum, its importance lies in that it allows for communication between, or emissary veins, between the venous supply, venous drainage of the nose, and the superior sagittal sinus, one of the dural venous sinuses. Now, we talked about emissary veins before, a connection with the cavernous sinus. This is a connection with the superior sagittal sinus. We will study these sinuses with the cranial cavity. So remember, the foramen cecum is for venous connection between the venous drainage of the nose and the superior sagittal sinus. Of course, this gives you a hint about the importance of this connection, because it leads to the inside, to the cranial cavity. It might carry danger from the outside to the inside. Okay, infections, of course, I'm talking about. Okay, so these are the accesses to the nasal cavity. Remember the cribriform plate, the foramen cecum, the sphenopalatine foramen, the incisive canal. All these lead to the nasal cavity. The incisive canals, we talked about the incisive canal, that it's two canals on either side of the nasal septum, and both open in a single opening, which is the incisive foramen. It transmits a nerve called the nasopalatine nerve that descends on the on either side of the nasal septum, of course on the septum, and descends and goes to the oral cavity. Remember this? We talked about the nasopalatine nerve that supplies the mucosa and gingiva of the incisors and the canines mucosa, right? Remember that? And also it receives the terminal branches of the greater palatine vessels, greater palatine artery that comes from the greater palatine foramen forwards, and then ascends up the canal to anastomose with the vessels in the walls of the nasal cavity. Okay? This is the incisive canal. Okay, when I told you about the looping around the nares of the nose, I meant branches from the infraorbital artery, or nasal branches of the facial, called alar branches, that loops around the margin. Okay, and I told you too about the branches of the greater palatine in the palatine canal that penetrate the lateral wall to supply it. Now, I think this is enough for the nose for today, and we will continue with the nasal cavity next time to conclude the upper airway. Thank you very much for watching.